Now I'm going to talk about using the AxGuard nerve connector in this technique that we call connector-assisted repair. And this connector-assisted repair is really meant for gaps less than 5 millimeters. So again, with direct repair, you can very easily misalign your fascicles. You put tension at the coaptation, and you have the potential for axonal escape. With connector-assisted repair, this helps to solve a lot of those problems. So you don't have to force you don't have this forced mismatch of the fascicles. You can leave a small gap between the fascicles, or between the nerve ends, to allow the axons, to find their own way. You can move your sutures away from the coaptation to the edge of the conduit, and that does two things. It removes any potential inflammation related to those sutures away from your coaptation, and it also helps to relieve tension at that coaptation. And then having the connector-assisted repair helps to prevent infiltration from surrounding tissue, and also helps to minimize any axonal escape. And so there are lots of different variations to this technique. Some surgeons like to put a loose air knot to hold the ends together and then slide the connector over. Some like to leave a small gap between the nerve ends. And connector-assisted repair can also be utilized in graft repairs, either allograft or autograft. And there is some clinical evidence for this technique. So this paper is a meta-analysis that was done by Dr. Duchek, and they looked at 12 clinical studies, 415 subjects. And what he found is that when a person received connector-assisted repair, the positive outcomes were 83%. Compared to the suture-only repair, which was significantly lower. And what was really interesting in this study is that there was a 50% increased likelihood of pain and sensitivity at the repair site when a connector wasn't used. And that, is probably likely due to neuroma formation at that coaptation. This was, demonstrated again in another study. And in this study, they looked at nerve wrapping to help prevent pain in digital replants. And what they found is that patients who received a wrap at the coaptation during the replant had significantly lower pain scores than patients who did not. And in both of these studies, these weren't necessarily our products. They weren't necessarily the AxGuard products. It was definitely not the AxGuard product in this particular study here. But what this shows is really the usefulness of the technique. It's really how important it is to protect the coaptation, to achieve potentially better outcomes and less pain utilizing this technique. And then again, I'm sure you are all familiar with this study by now. This is the Schmidhammer study. And again, just provides some good evidence on the benefits of relieving tension with connectors. They saw less scarring, better revascularization, and better functional outcomes. Now, this is an interesting study, just a little added benefit of connector-assisted repair. This was a cadaver study that we did that looked at connector-assisted repair, conduit only, which was essentially leaving a large gap, like if you were using a conduit to repair a gap, and then direct repair. And we had experienced surgeons and we had inexperienced surgeons doing all of these techniques. And we came up with a grading scale. And then we had some blinded assessors who went around and graded the nerve repairs based on this grading scale. And what we found is that connector-assisted repair basically levels the playing field between the experienced surgeons and the inexperienced surgeons. So, there were when you look at how many surgeons were graded as excellent in the suture repaired for experienced and inexperienced, you see, there weren't very many in the inexperienced group who were graded as excellent. But then when you look at the connector-assisted repair, you see that, that number increases and is much closer to the experienced surgeons than for the suture-only repair. So, it just helps inexperienced surgeons do a technically better repair. And then finally, another little added benefit of connector-assisted repair has to do with the strength of the repair. So this was a study that looked at how strong coaptations were with varying numbers of sutures, either just for direct repair or with a connector-assisted repair. And what they found was that a connector-assisted repair with 2 sutures at the edge of the conduit and either no or 2 sutures at the coaptation was just as strong as a 4-suture direct repair, but had the benefit of less sutures at the coaptation.